Gingell is absent with notice. Howell is absent with notice. Kirshenson.
Here.
Taylor.
Here.
Erickson Galt.
Here.
Nelson.
Here.
Cavell will be arriving shortly. Joliet.
Here.
Lutz.
Here.
You have a quorum.
Thank you. Please join me in rising for the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Our first item is approving the minutes of March 5th, 2024. And a motion by Commissioner Joliet, support from Commissioner Nelson. All in favor say aye. Aye. Opposed? Our minutes are approved. The next item is approving the agenda. I have a motion by Commissioner Nelson, support from Commissioner and Erickson Galt. All in favor say aye.
Aye.
Opposed? All right, our agenda is approved. We've arrived at our first public comment. Is there anyone from the public wishing to speak on items on the agenda? Then you would come to the head of the table and state your name and community, and you have 3 minutes.
My item is not on the agenda.
Then we have another public comment at the end. Thank you. Anyone else for public comment? All right, this public comment is closed. We move to communications. There are 3 items under communications. The first is a grant application exception for the 2025 high-intensity drug trafficking area grant. The second is Oakland Community Health Network Director's Report from February of 2024. And the last item is the intake and disposition report from February 2024 from our Animal Control Department. Any questions? Then I have a motion by Commissioner Nelson to move the communications and support from Commissioner Taylor. Anything else? Do you want to prompt the vote on this one? Roll call.
Just do, yeah.
Okay, all in favor say aye.
Aye.
Opposed? Communications are approved. We move to our presentation about our 911 system, and we have our major and sheriff's office here. No? Thomas. Thank you.
Come on and do it.
Stand in the background for a photo op. Patricia.
Yes.
Thank you, welcome.
Thank you. I appreciate the opportunity to speak to the committee. For those of you that don't know me, I'm Patricia Coates. I am your county 911 coordinator. I've been in that, well, you know, I've been in that position since 1998, but I actually started as a dispatcher at the Sheriff's Department in 1975. So I've been here since before there was 911. I know you've been asked me to come here specifically to talk about fees, but I think it's important that you understand a little bit about the 911 system, how it works, and specifically what the role of the Board of Commissioners is in managing and overseeing 911 for a county. 911 is not, despite what you see on television and in the movies, it is not magic. It is not divine providence. It is not a miracle. It's a phone number. 911 is simply an easy to remember phone number. When I started in 75, every single police department and fire department had individual little phone numbers that people had to remember in an emergency. So a few years later, there was a nationwide effort to have 911 be the one easy to remember. It is still not nationwide. There's still parts of Michigan, or not Michigan, but the United States that do not have 911, which is surprising to a lot of people. So it is a phone number. Like any phone number, it's regulated. It's part of the telecommunications industry. So there are tariffs, there are telecommunication acts, there are federal and state statutes that govern telephone service, and 911 is a part of that. We tend to talk in jargons a lot in public safety, and I want to explain one term I will be using because I will use it a lot. It is the term PSAP. It stands for Public Safety Answering Point. All it means is a dispatch center where 911 calls are answered. When you dial 911, it goes to a PSAP. And we have 19 of them in Oakland County. The Sheriff's Department is one. Many of your local communities at police departments also have PSAPs. My role as the county coordinator, in addition to some things that are defined in statute, is to be a facilitator for all those folks, to make sure they're up to date on technology, legislative requirements, training, etc. But I'm also here to be a facilitator and a resource for the board, because you have a very big role in managing 911. It doesn't come up often, but when it does, you have a lot of work to do. So 911 is regulated at the federal level, primarily by the Federal Communications Commission. They are the overseers of wireless communications or cell phones, and 85% of our 911 calls now come from wireless devices. When we first implemented Oakland County's 911 system in the mid-1980s, it was based on landlines. Everybody had landlines. And it was an old-fashioned telephone copper network that transported the voice and a tiny bit of data that told us where the landline was located. It wasn't great, it wasn't accurate, but it worked, and it worked for a lot of years. As new types of devices were introduced, cell phones, voice over IP, voice over the internet on your computer or your tablet, we kind of retrofitted the 911 old copper network to make it work with those devices, but it was never designed for those. So a few years ago in Oakland County and in Michigan, we started migrating to what's called Next Generation 911. This moved us off those old copper networks and onto IP. Basically, we are now on fiber. And all of our PSAPs in the county here are connected by that fiber. This allows a lot more data to go through. We can get far more information out of cell phones now than we ever could before. You can use it for texting to 911, which was not possible on a copper network. And texting to 911 is very important. It's important primarily for the speech and hearing impaired community, because that's their primary form of communications. But it's also very important for any kind of emergency situation where a person cannot speak. I might be a victim of domestic violence. My spouse might be sitting next to me. I don't want to sit there and call 911, but I can text. Or I'm a child hiding in a closet because I hear noises. Or I'm a kidnapping victim in the trunk of a car and I don't want to make noise. Texting to 911 works very well, and we get very good location information about the caller. So that's just one of the examples. Eventually, this can be retrofitted to include photos and videos from the public, so that when you're reporting your child missing to a PSAP, before an officer's even on the scene, you can send a picture of that child with your phone call, and the PSAP can send it out over the computer system to the officers so they can all see the child before an officer even gets there. We have a lot of translation information available, so if our caller is speaking a foreign language, especially on texting, it's kind of cool. If a caller texts to us in Polish, we see it in English. We reply in English, they get it back in Polish. So you can communicate. So all of these things were not possible before. And since 85% of the calls are wireless, all of this is capable because the new handsets are so capable of so much stuff. Before, people would say, you know, the pizza place knows where I am. How come 911 doesn't know? Well, we didn't know for a lot of years on that old network. Now we have more and more information about where they are and what their issue is. So we have 19 PSAPs in this county, all functioning on Next Generation 911. But Next Generation 911 is a living document. It's evolving. Statutes and standards change all the time. Technology changes all the time. It's a little hard to keep up with sometimes. The FCC governs a lot of 911, particularly the wireless. But in the state of Michigan, the wireline services and the VoIP services are governed by the Michigan Public Service Commission, because telephones are a utility. So they have to be tariffed, and they have a lot of rules and regulations they have to adhere to. The biggest statute, and you have a lot of these documents in your packets. I'm not going to read them to you. You have enough boring reading to do there. Public Act 32 of 1986, as amended, is the primary 911 statute in Michigan. It's called the 911 Service Enabling Act. and I would like to cue in on the word enabling. 911 doesn't just happen. The phone companies don't just provide it. It needs to be enabled because it's a very expensive system for the phone companies are in the business of making money. They don't give away a service like this for free, especially such an expensive one. So it needs to be enabled. The only body that can enable 911 in a county is the County Board of Commissioners. Police chief can't do it, a city council can't do it, the state can't do it. 911 is only enabled by the Board of Commissioners. And you do that through what is called in the statute, and there are very strict mandates for what it needs to include with a 911 service plan. That plan needs to include fiscal, operational, managerial, and technical aspects of 911. And we don't amend it, or we don't rewrite it very often because it's a cumbersome process. One of your documents explains what that process is. If we need to make a major change, the last one we did was in 2013 when we switched from the copper network to the IP network. We were gonna have new service providers, new capabilities, we needed to rewrite the plan. So someone, which is usually your county coordinator, in conjunction with corporation counsel and a lot of stakeholders, has to rewrite what's called a tentative plan, and we put in all the changes we think are needed. You adopt that plan by resolution as a tentative plan, and there are things that need to occur. When you adopt the tentative plan, you need to, at that time, set a time and date for a public hearing, which cannot be anything less than 90 days out. The county clerk has 5 days to notify the clerk of every city, village, and township in this county about the plan, because we want total transparency. There have to be some public notifications. The PSAPs, even if they're already PSAPs, need to reapply to be PSAPs under the new plan. They have 45 days to do that. At the end of the public hearing, you can then adopt it, the same plan, as the final 911 plan for Oakland County. If there are any changes between the time you adopt the tentative and that final one, the whole process has to start over. You have to re-adopt a tentative plan, notify the cities, villages, and townships, everything has to start over. So normally, a complete rewrite of a plan takes about 6 months. It's not something we do frequently. There are some smaller things that you can do by board resolution that amend a 911 plan that are allowed under the statute. One example of that primarily is if a PSAP decides to no longer be a PSAP, if they're going to contract with someone. The list of the PSAPs is in the plan, so that requires a board resolution to amend it. So I've come to you many times in the past when Clausen decided to stop being a PSAP and contract with Troy, when Beverly Hills decided to stop and contract with Birmingham, when Auburn Hills decided to stop being a PSAP and contract with the Sheriff's Department. That all required plan amendments that you can do by resolution. But a rewrite of the whole plan is a big deal, and we only do that very often, like I said, when we had to redo the service provider. You might redo it if you had a managerial change. Right now, the plan says that my position and 911 you have given under the management of Clemis and the IT department. If that ever changed, if you wanted to move it to someplace besides Clemis, or if Clemis was no longer under IT, that would take a plan rewrite. That would take the whole 6-month procedure, because that would be big. So just to let you know, you have the plan. You are driving the bus here. It is your plan, and you are the only ones who can do it. Public Act 32 was last amended in 2021. That is designed to sunset every few years in Lansing because technology changes. Funding needs change. So the next time it will sunset is 2027, and it will need another rewrite. I or your other someday 911 coordinator will come to you probably and ask for a resolution to support the rewrite of the plan. That's part of what we do too. So the fees for 911, I know you get some questions on. there are lots of different fees on 911. If you get a call from a citizen and says, "What's this on my phone bill?" It depends on what kind of phone they have and how they get that phone service. It differs. I still have a traditional landline, plug in the jack in the wall. I have that because I need to make 911 test calls from home. Hopefully someday that will go away. This was originally designed for landline phones. So there was originally what was called a technical surcharge. Nobody saw that money except the service providers. And back in the day when we first started this, we were with Michigan Bell, which later became Ameritech and now is AT&T. And now we are with a fiber company called Peninsula Fiber Network, or PFN. That is a Michigan-based company. They do our network for us. We're no longer on the copper. So I have a landline. That technical charge still exists because the AT&Ts of the world and the other, Pigeon Phone Company and Wolverine Phone Company in the Upper Peninsula, all those folks have costs associated with 911. They have to make sure that that landline connects to a central office that connects to a 911 set of routers that will get it to a PSAP, so they have expenses. So if I call you and say, "What's this on my phone bill?" and I have a 50-cent a month charge, that is the technical charge. That just goes into a pool for the 911 service providers and the phone companies to access. Counties don't see any of that, the state doesn't see any of that, it's just for them. We have, unfortunately, no control and no real auditing of that. They just turn in their fees every year and say, "All right, this is what it costs us this year, adjust it to 52 cents. They hardly ever say, "Adjust it to 45 cents. So that is on my landline. Also on my landline and on my cell phone is 25 cents that goes to the state. And that is if I have a contractual wireless service. If I don't have, I get a monthly bill from T-Mobile or someone. I'm contractual. I have a 25-cent state charge. But a lot of people don't do that anymore. They get their phone service over the internet or someplace out of state, and they, just miraculously have service. They don't have a bill. It just comes off their credit card every month. So if there's no billing address in Michigan, because I'm not a contractual customer, then the state fee is 6% of the transaction. So if I load unlimited service for a month through my internet provider that's going to give me my wireless, 6% of whatever that is supposed to go to the state. That doesn't always happen very well because a lot of these folks are out of state or even out of the country and don't know they're supposed to pay Michigan 6% of the transaction. So the state has a lot of issues trying to collect that money. Then there is, on anything that any landline or wireless device that has a billing address in Oakland County, there is a local fee. And in our case, that is 42 cents a month. I pay that on my landline. So on my landline, I pay 50 cents for my technical charge, 42 cents to Oakland County, and 25 cents to the state. So if you ever get calls from citizens who say, "What is this on my phone bill?" and you want to have them call me, please do that because you will never remember all of this. So what happens to all that money that the state is collecting? 42 cents is the most a county can assess by board resolution. You can go up to $3 by a vote of the people. And many counties outstate of Michigan have done that. They're well over the 42 cents. Some are even up to $3 because they don't have the number of phones we have. They have more deer than they have people. So they can't collect enough with 42 cents to do anything. So they have gone to a vote of the people and have gotten additional funding. Some of those counties also have dedicated 911 millages that just pay for 911. Here in Oakland County, we are at the maximum. We are at 42 cents that the board can do by resolution. So the phone companies and the wireless providers collect that money. and they remit it to our treasurer. They get to keep 2% of it off the top for their costs for collecting and billing because, again, they're in the business of making money. So there's 2% of that we don't see. Because these are contractual people with a billing address in Oakland County, our collection's a little easier than the state is with all that internet stuff. So, but we still don't get a lot of information. We have to rely on trust with the phone companies. If they say, I have 500 customers in your county, here's the money, we have no way of proving that. We have some good estimates based on some national standards, et cetera, that tell us they're probably in the ballpark. But there's a lot of trust or mistrust that occurs in the collection and remittance of 911 fees. The state, with their 25 cents plus the 6% they get on what they can collect, by the statute, have to distribute it in certain ways. 65% of what they collect comes back to the counties. But Oakland County tends to be a bit of a donor county in this one because we don't get it back strictly based on population. We have a lot of people in this county paying 25 cents to the state. We're not getting back the total amount they're putting in. What we get back is 60% is based on population, and 40% that comes back to the counties is a flat fee. So that flat fee that we get back is the same for Oakland County, Wayne County, or Baraga County in the Upper Peninsula. Everybody gets that same flat fee. That way, it helps appease the northern counties because they say, well, all your Oakland County residents come up here for their cottages and wildly dial 911 all the time. So they feel they're justified in assessing part of the fee, and we get a substantial amount back from the state. So 65% of that 25 cent comes to the counties. A big chunk, 25.56%, pays for the network. It pays for PFN. That is not a county expense. What PFN does is once you tell them to enable 911 service in your county, they build out their network of fiber to all the PSAPs. They have data centers where there are routers and servers and all kinds of magical things that make the 911 call that's supposed to go to Troy, go to Troy. And the one that's supposed to go to Novi, go to Novi. All that happens at these data centers. They have a significant cost. PFN is the network provider for 911 in all of Michigan except Macomb County. They are still currently on a copper network. They're the only county in Michigan. They have just finished an RFP and they are awarding their next generation 911 network. But what PFN does is they built it out. And in our case, they built it out 2 redundant data centers, 19 PSAPs with redundancy coming in from different directions. It was a huge undertaking and very expensive. PFN doesn't get reimbursed for that until it's all built out. And then they submit the cost study to the Public Service Commission and get reimbursed. So this is a very costly thing for PFN to do, but they're also an excellent service provider. We've been very lucky with them. So I'm happy to say that's working out well. So 25.56% of this state money that's collected goes into a fund for the network. And when they submit their cost study, they will go into that fund and get reimbursed. They can also get reimbursed a portion from that technical charge, that 50 cents on landlines. That's pretty small because landlines are going away, except for me. So that is another huge expense. 5.5% of the money the state collects goes into a dispatcher training fund. The state statute requires certain levels of rudimentary training for all 911 operators in the state. What the PSAP does is they apply to that fund, depending on the number of full-time equivalent dispatchers they have. They have to apply every year. There are only certain classes they can use it for. And then they are able to use that fund for their dispatcher training. It's not enough for all of the dispatcher training. If there's any magic in 911, it's in those operators. Their skill and experience and what they need to know and how they need to remain calm is amazing. So this dispatcher training fund is a piece of what they need to know. 1.5% goes to the Michigan State Police to help fund their dispatch centers. They have 3 of them in Michigan. And another 2.44% goes to the MSP for what's called the State 911 Office. One of the things the statute does is create a State 911 committee of stakeholders who review issues, make decisions. They don't have a lot of power, but they make recommendations to the Public Service Commission and to the legislature. The State 911 Office is their administrative branch. They're the ones who do all the actual work. And they are under the MSP. So that is what happens to that state fund. So if one of your citizens wants to know that, you can tell them. So what happens to the local surcharge? That comes back to the county, except for 2% that the phone companies keep. And our county, it is placed in what's called the radio fund. It needs to be in a separate fund. You cannot stick it in general fund. The FCC has come down very hard on 5 states that have just been putting it in general fund with no accountability, and nobody knows where it went. You can't put, it has to be in a separate fund, it has to be audited separately, and there are certain restrictions about what it can be spent on, because this is a service. We never, ever, ever call this a tax, because it's not. It is a fee for service. There was a 1998 court case in Michigan, Bolt versus the City of Lansing, where the City of Lansing Water Department, which is a utility, was charging a fee for something totally unrelated to water. I think it was for parks. And the citizen said, wait a minute, if I have to pay this water bill and I never use a park, that doesn't make any sense. So the City of Lansing lost that case. So it's very important to understand that this is a fee for a service, and 911 is part of the telecommunications service. So the money can only be spent under a very restricted manner for things that facilitate the communication between help, my baby's not breathing, my house is on fire, I've just had a car accident, to I'm the dispatcher, I'm here to help. I will send you the police, fire, or EMS you need. And then I use a radio to send that help. That is the extent of what 911 fees can be used for. If you try to expand that and use it for other things, you're required to repay the fund. And if it's state money, you have to repay the state. We've had a couple counties that have done that. One county in the Upper Peninsula said, well, we can use it for street signs because you can't find anybody if they don't have a street sign, so it's part of 911. Well, it's not. You can't use it for a fire truck. You can't use it to pay police officers' salaries. It's got to be the communication piece. The caller to the dispatch center to the help they need, and that's it. So we have very restricted use of the funds that we can do. How the funds are distributed, how we expend those funds, is defined in the 911 service plan, which you have all developed, or your predecessors did. And that's different all over the state. You can give the money directly to a PSAP. And some counties do that, primarily the ones that have one consolidated central dispatch for the whole county, because it's easy to track and keep track of. If we gave 911 surcharge to 19 different entities and they had to keep it in separate funds and make sure it was only used for certain things, and if one of them made a mistake, it's not the city or village that has to repay the state, it's the county. So we would be on the hook for someone else's mistake. Plus, there simply is not that much money with 42 cents plus what we get from the state. And I'll go over how much we get in a minute. So what you've done in the 911 plan is, instead of giving money directly to the PSAPs, you give them services and equipment. That way we can track it and make sure that what we're doing is correct. Part of what you give them pays for part of the 911 system itself. When I receive a 911 call at my dispatch center, at my PSAP, I have a very specialized phone I answer it on. It has a display, it gives me all sorts of addresses. It interfaces with maps, it interfaces with my computer-aided dispatch provided by Clemis. It does all kinds of special things. I can make transfers, it does the translation into foreign languages, it does all that stuff. So that's a very specialized piece of equipment. We have, in our county, each PSAP pays for their own workstations, which are basically computers with a phone. But the software and everything that has to happen to make the calls go to them, the county pays for with the 911 surcharge. So to make sure all 19 of them are always on the same platform of software, because it's networked, they transfer back and forth to each other. If I need to evacuate my PSAP because of a bomb threat or a flood or COVID or something, I can go to a neighboring PSAP and sign on. I can be Farmington Hills and go to Novi and sign on and get my Farmington Hills calls because it's networked. We also have a backup center for them that they can use, which is unmanned most of the time. But if they do need to evacuate or they're remodeling, we have the dispatch center at the old Pontiac Police Department, which is a sheriff's department substation now. That has 6 workstations in it that they can go to. So we pay a portion of that for them. They just pay for the workstations. That way they're always on the same software, they're always all trained the same, they can always do the same thing. But the bulk of what we spend money on is the radio system. We have, as you all know, recently replaced our radio system in Oakland County, our public safety radio system. That is part of that continuum of communication, so that's an allowable surcharge or fee usage. So we do that in this county, and that is the bulk of what we expend the money on. All the consoles, the radio consoles in the PSAPs are paid for with that fund. They don't have an expense for that. The majority of the public safety radios, the portables and mobiles and the patrol cars and fire trucks are paid for with that. Not all of them, because some of them have special needs, or they have special antennas, or they have special chargers, and they also might need more than they were allocated by the 911, the radio committee. So they do have some expenses for radios, but the bulk of them we pick up. The really expensive part is all those towers. We have many, many towers in this county supporting many, many frequencies to make sure they can all interoperate with each other, but still operate independently when they need to. Those towers are connected not only to each other, but to the state system, so that if the sheriff's department is taking a prisoner transport to Jackson Prison, they have radio communication the whole way in case they get into trouble. Or if our fire departments are assisting with a major forest fire up north, they can talk to the fire departments up there. So it's that infrastructure that's huge, and it all needs to be connected. It's connected with fiber, it's connected with microwave. That is the expensive chunk. Plus, we don't own a lot of those towers. We pay rental fees to the people who do own them, American Tower or AT&T or someone. And that's another expense. Those are all paid for with the 911 fund. So your local police and chiefs and fire chiefs don't see that expense. And I don't know that they always understand how much that costs or what we're doing with it. So to let you know, for 2023, from the state, we received just over $1.9 million of that fee. Our local 42 cents was just over 6.6 million. So we achieved just over 8.6 million in revenue. The little 911 portion that we pay, not the workstations, but all the software and all the things that make it happen, we expended 1.9 million on that. The radio project was 6.677 million. That is by far the biggest expense of the 911 surcharge. So altogether, we received $8.6 from revenue, and we expended just under 8.6 million. There is no extra money. And 911 fees are not necessarily a great source of future revenue, because of the way cellular calls, they're getting cheaper. If I go on the internet and I get a big bundle of things, that 6% that I'm paying to the state might be less than what I paid 2 years ago. Or if I bundle it, the phone companies say, we can't tell you how much of this goes to phone and how much of it is cable and how much of it is internet, so we don't pay it at all. So people are doing away with landlines, right and left. So that is another source of the fund that's going away. So 911 fees have pretty much been shrinking slowly. They've kind of plateaued for now. So it's not the greatest source of long-term funding, but it is going to be viable for a lot of years. So our plan says we do not give money directly to the PSAPs. We pay for services and we pay for equipment. So when you get a question that says, how much money from your surcharge goes to the Sheriff's Department or to Novi or to Rochester or to Troy, the answer is 0. They don't get any money. What they get is services and fees, and they all get it. So you're not funding any portion of the Sheriff's Dispatch except for equipment and fees. You're not funding any portion of Hazel Park or Troy except for equipment and fees. So, who makes sure we're spending all this correctly? Who's our watchdog? Well, the FCC watches it. Like I said, they've come down on 5 states that they found were putting it in general fund. What occurs is, as your county coordinator, I have to do an annual report to the state, which goes to the legislature, which then goes to the FCC. And I have to say how we spent this money, how many calls we received. In 2022, I don't have our numbers yet, but we processed just over 600,000 911 calls in Oakland County. So I have to do this annual report. Under the statute, only 2 people who can do this. It would be your county coordinator or the county clerk. And I suspect the county clerk is very happy that the county coordinator does it because it's a very lengthy report. But I have to describe what we've done. And I have to show that if we're paying for radio, it's just for 911 responders because it has to be tied to that communication link. So for example, the sheriff corrections radios in the jail, they don't go to 911 calls. They need communications. They need to be able to talk to each other and to their command staff, etc., but they're not 911 responders. They are not eligible for radios paid for with this fund. They pay for their own, and they pay a small fee for the use of the network to make sure that we are not using any 911 funds for things that are not 911 responders. So I do that every year, and I have to send our accountability, fiscal services helps me with that a lot, and the radio department to make sure I've got it all correct, and I send that to the state. They want to make sure that we're spending it correctly. They also do what is called a compliance audit. The state 911 office actually comes out. They do 10 counties a year, so we get it about every 8 years. We are overdue, so I'm sure our turn is coming. They come out, they visit every PSAP. They want to know what everybody's doing. Are you meeting the best standards? Do you have a generator? Do you have security? How are you operating? They go to every PSAP. They also check to make sure they're spending their training funds correctly, that they're not sending cops to gun training, which has nothing to do with the 911 network. They want to make sure that's all happening. And then they come here to the county and they look at all those millions of dollars, and we sit with them for many, many days and show invoices, and here's where we spent the money, and this is the type of radio we bought, and this is what we did with this, and this is how much the microwave cost. And they check all that because they will make you pay it back if you're not using it correctly. In fact, if you don't do the annual report, they won't give you the state funds for the next year. So they're pretty strict about what we do with the money. So I do this annual report, and then I also participate in the certification when they come around and check on us to see what we're doing. And it's not me, I mean, it's a team of people that do this. And we all do this to make sure that your 911 plan is functioning the way you intended. managerially, operationally, technically, and fiscally, because those are the four things you are in control of. So this occurs to make sure that it's working the way you intended it for Oakland County. And basically, that's 911 in a nutshell. I don't know if you want to open it up for questions?
Thank you, that was a lot of information.
I know. If you want to just have your citizens call me, that's fine too.
Thank you. So with the current 911 system, if somebody calls now using a cell phone, are you able to pinpoint where they're calling from?
That varies. It depends on what kind of condition the cellular company's network is in. We've all seen some outages lately from some of the folks. You might have seen your phone go into SOS mode sometimes, where the only thing you can do is dial 911. That means there's a problem with the network somewhere, and it will guess who your appropriate 911 center is. If you still have a flip phone, it's not getting a lot of data out of that phone, so it's triangulating off 3 towers if it can find 3 towers and trying to predict about where you are. So part of my job is to make sure that the very basic, if the network is down, you're using an old handset, all it can depend on is those towers. Part of my job is to make sure there's some basic routing in place, that it knows where to send it. For example, if there's a cell tower at 14 and Campbell, and they have antennas going this way, and antennas going this way, and antennas going this way, part of my job is to look at that and say, all right, every antenna facing north should go to Troy. All the antennas this way should go to Madison Heights. These should go to Royal Oak. And there's a database that I maintain for that very rudimentary form of routing to make sure it goes somewhere. There are still times it doesn't know. If a tower is busy, it'll bounce to another tower. It'll bounce to another tower. We can get calls, especially along 8 Mile. We get a lot of calls from the city of Detroit. And they get a lot of calls for us. So there's a lot of transfers back and forth. That happens at the county lines or at the city and township lines. We might see some. But we have recently moved to what's called geo-based routing. It used to just be tabular, and it used to just be guessing which cell tower processed the call. But now, thanks to PFN and our partnership with them, we actually have geo-based routing. So instead of looking at the tower, they're looking at your handset. They're looking at the GPS in your handset. They're even looking at all kinds of other things that you don't even know are in your handset, like barometric pressure, to try to determine if you're on the 1st floor or the 5th floor of a building. So the routing varies depending on the handset and the condition of the network. Most of the time, it's pretty good, and it plots very accurately on a map. And in many instances, if you're moving, we can see that you're moving and follow you along on the map because it keeps updating. So it's gotten much better than it was. It will never be perfect because it's wireless and it's technology.
Thank you. So then sounds like maybe 2026, we need to rewrite this again. Are you looking for something earlier or additional monies for enhancements?
No, what we're doing right now is the 911 equipment at the dispatch centers is nearing its end of life. We had a contract for the first 5 years, then we had a second 5-year contract for a hardware refresh. We are in the 4th year of that, and they actually still have not quite completed the hardware refresh. So eventually, we need to replace the 911 workstations at the PSAPs, and we want that again to be a countywide bid so that they can interoperate and go to other PSAPs and just sign on. So we do have an RFP in the works right now for that. I don't have any idea what the expense will be because we won't know till the bids come back. But we will probably be implementing that sometime in 2025. It is expensive, but the good news is the radio system is pretty much built out. They've bought all the radios for everybody, so some expenses have gone away on that end. So hopefully there will be enough on the other end to pay for this. To actually rewrite the whole plan, where you have to do the whole 6-month thing, would require a major change. Like I said, if managerially they made some changes to Clemis or IT, and my position was no longer under them, that would take a rewrite. But it takes 6 months. You will know that way in advance. That's not going to be something, so I don't anticipate when that's going to happen. Now, the legislation in Lansing sunsets in 2027. We will start next year trying to educate all the legislature on that, because that takes a long time. They have turnover, they have people who've never heard this before, and it takes a very long time to explain to them why the network costs so much, why the PSAP operations cost so much. They want to know all of that before they'll approve any changes. So that will probably begin in 2025 as well. It takes about 2 years to get everybody educated and to get it written and to get it passed. And then we have to notify all the phone companies. When you amend the county plan, I have to notify all the phone companies in writing of any changes we've made. They have 180 days to implement them. So nothing in 911 when it comes to the management of it moves quickly. When it comes to answering an emergency call, it happens instantly.
Thank you. Are there any questions or comments? Commissioner Cavell?
Thank you, Chair. Forgive me if you already talked about this because I walked in late, but you were going over the numbers and I didn't catch them all in terms of the budget. And so one question I had is on our documents here, if I'm reading them right, the revenues from 911 total, now this might not be in just 911, but the revenues from the radio communications fund say 10.58 million, and you said something like 8.6?
I don't know. This is brand new 2023 numbers. I just got these this week.
That you're talking about?
Yes.
Because that's what I'm looking at too.
Okay. No, they show that our revenue was, well, there are other monies that go into the radio fund that are
Sure.
not 911 fees. For example, the towers we do own, we charge rental fees for the cell companies to be on those towers, so we get that money.
Okay.
The Sheriff Corrections pays money into the fund to operate on the system because they're not 911 responders. So this is just 911 fee. The radio fund has other money coming into it. That may explain the discrepancy.
Cool. Okay. Thank you. And then I just had two more quick questions.
Sure.
Thank you. So one is like a theory kind of question, and one is, you mentioned the fee. Which do you want first?
That's up to you, sir.
Okay, cool.
I'm ready
So,
for either one.
Let's finish with the theory. All right, so the fee one, you said 42 cents from every person's phone line gets,
That has a billing address in Oakland County.
and is that 42 cents a month or a year?
It's a month. There are some exceptions. We tried to make legislation as business-friendly as possible. We have some very large businesses in this county. If they had to pay 42 cents on every single phone line, that would be an exorbitant cost for them. So for multi-line systems, it's slightly different. If I have 62 phone lines for my business, I pay 42 cents on the first 10. So I pay $4.20. On the next 10, I only pay 42 cents for all 10. And then when I get up to where there's only 2 at my 62, I pay for them as if it's 10. So the businesses are given something of a break because this would be a huge expense for them. And many of them also give out wireless devices. But not every business has a billing address in Oakland County. We have facilities from the Detroit Medical Center. All those phones are billed in Wayne County. We don't see that revenue.
Sure.
So it varies,
Okay.
but it's 42 cents for billable addresses. If you get your wireless phone over the internet and they just charge your phone, your credit card every month and you never receive a bill, they may not even know where you live. And it's up to you to enter a 911 address into their database. And when you move, you forget to do that. And you take your laptop to your cottage and you call 911 from there and you forget to change it. That happens all the time. If you don't have a billing address, you're paying only the state fee. You're paying the 6% per transaction.
Got it. So the 42 cents a month,
Mhm.
and then you said that some places have a vote of the people to allow them to
Yes.
go up to $3.
By the statute, you can go as high as $3 by a vote of the people.
$3 per month?
Yes.
And is that considered then a millage, or is that then
That is a
fee
911 fee
that people just on their phone bill?
on their phones. The other counties do have actual dedicated millages
Right,
and don't use, there are counties that don't use this fee at all. They get the
Right.
state money, but
Yeah.
they don't have a local fee.
yeah,
And there are people who just have millages. There are people who just use general fund.
okay,
It varies all over the state.
okay. So then it could be a vote of the people for a millage, a vote of the people for a surcharge. There still would be the 42 cents is the county board maximum.
Right, and if you went to $3,
Yeah.
that 42 cents is part of the $3.
Right,
You
three
can't
total.
charge $3.42.
Understood. Could you do a like 42 cent or like a 50 cent surcharge at the vote of the people?
Yes.
So that then it's not, but okay, interesting, very cool. And that's 2027, the new plan has to be done?
No,
No.
2027 is when the legislation sunsets. I don't know when a new plan needs to be done. It's when we have a major change.
Okay, okay,
So hopefully it won't be a while,
sure.
or it might be next week. Who
Okay.
knows?
Right. And my last question was, as you had kind of mentioned, there are different models of this sort of how this can be administered.
Mhm.
And you mentioned Clawson, or like in Ferndale where I live, right there, there's the local administration of 911. But there's also countywide. Which do you prefer and why?
I think they both have a lot of benefits. We've had the model of local PSAPs in this county for a long time. We did have a movement at one time, right around the turn of the century, to form a consolidated central dispatch. That is a very specific type of dispatch under the state statute. We actually even made an offer on a building, and most of the PSAPs were going to participate. HR worked miracles with us, I've never seen them do this, to make sure that dispatchers with 15 years of experience weren't starting out as brand new county employees. They were bringing them over 15 years of seniority, 15 years of benefits. Everything was going to work out. The problem we ran into was retiree health care. Very, very few, only one in fact, of the communities had funded their retiree health care. So if their dispatcher was coming to the county expecting retiree health care, some money had to come with it because our benefits were very different. And since they hadn't funded it, they said, we can't do it. We can't do that to our people that have worked for us for 15 years. The whole thing fell apart. It also fell apart for a number of other reasons. Building that much trust took a long time, and when there wasn't enough money, and some of the PSAPs, like Ferndale, for example, you have one or two dispatchers sitting there. They're also helping out with the administrative phones. If you call the chief's office, the 911 dispatcher answers it and transfers it to the chief. So they do a lot of administrative stuff. They also watch prisoners. They also man the front desk when someone walks in. They're watching cameras in case somebody out in the parking lot is doing an eBay transfer of something and they want to be on a supervised place, or a child transfer during, a divorce, that sort of thing. So the dispatchers do a lot of things that are not 911. So if they were moving just the 911 function to the county, they still had to have people there. So they decided not only was the healthcare an issue, but the fact that we still needed people there, we weren't saving enough money. The whole thing fell apart. My preference is whatever works best for the community, because that's what 911 is here to serve. If a community decides we want our own PSAP and we're willing to take the expense, because this is not cheap. They have to pay all those salaries, they have to pay for equipment, they have to pay for utilities, etc. If they decide that's what they want to do, if they decide they want to do away with their PSAP and contract with a neighbor, then I help facilitate that, because that's my role. The one thing I do like, and that I try to insist on when these people are looking at mergers and acquisitions and stuff, is that the 911 should be answered at the same PSAP that dispatches both police and fire. Because we have some, and we've historically had some, where 911 calls generally route to the PSAP that is your police department, because most 911 calls are for law enforcement. The fire departments will tell you that most emergent calls are for fire, and the sheriff and the police department gets, the report kind of stuff. But most 911 calls are for law enforcement, so generally a community will decide to route their 911 to their law enforcement. If somebody else dispatches fire or EMS, that means you have to transfer. That inherently creates a delay. That is the thing I most object to. It should be the same place doing both police and fire, so that when I'm getting the call and I'm entering this into my computer-aided dispatch, if I'm a small PSAP, I'm also talking on the radio at the same time. If I'm a large PSAP, like Southfield or the sheriff, I'm entering it into computer-aided dispatch. It's appearing on the screens at the dispatch consoles. Police, fire, EMS are all being dispatched simultaneously. There's no delay in transferring. So to me, that is the most important thing. Whether or not it's a local PSAP or a countywide PSAP, there are obviously some cost savings to a countywide PSAP. But there are also expenses for the locals. Like I said, they need to keep people.
Okay.
So I don't prefer one model over the other. They both work very well, at least in this county. But what's important is the same PSAP do police and fire.
Okay.
Thank you. Thank you. So we have a paper that was delivered to us to receive and file regarding the 911.
Just do a motion to second.
Okay, all right. So I need a motion to receive and file the paperwork. I have a motion by Commissioner Gershenson, support from Commissioner Joliet. All in favor say aye. Aye. Opposed? All right, that's carried. We have this added to our information. Thank you very much.
Thank you for your time. I appreciate the opportunity.
The learning
Any
lesson.
questions? I'm there for you, or your citizens.
Thank you. We move on to a circuit court recommendation and amendment to the fiscal year 2023 virtual backlog response docket grant program. And who would like to make a motion? I have a motion by Commissioner Joliet, support from Commissioner Cavell. And welcome. What would you like to tell us about the amendment?
Hi, nice to see everyone. I'll try and be super brief. We have, at the 11th hour, the grant that was going to expire March 31st, SCAO has granted us an extension, not just through the end of this year. This was a calendar grant, not a fiscal year grant, so it's kind of carried across 23 and 24. They are now going to allow us to the end of 25, and they have awarded us additional funds to carry us through 25. So we will be continuing to pay for visiting judges and clerks and staff attorney to facilitate kind of getting through some of these trials and these cases that have just been languishing on our docket. Much of what they're doing is taking work maybe not in the more complicated cases that have been languishing, but they're freeing up the judge's time to focus on those by hearing some of these other matters that are a little bit more simple that can go to a visiting judge.
Thank you. Thank you, it makes sense. Any comments or questions? Commissioner Cavell?
Does any of this go towards the guardian ad litem gap that you have?
No, unfortunately, that the guardians and the attorneys, we can't pay for really out of this. This is just for backlogs. And none of it is for probate court, which is where the majority of our guardian expenses are.
Okay.
Thank you. Anything else? All right, would you prompt the vote?
Yes.
Yes.
You have 7 yeas, 0 nays.
All right, motion carries. Thank you. we move on to our Sheriff's Office recommendation. This is an amendment to the Michigan Commission on Law Enforcement Standards for Public Safety Academy Assistance Program. And we have Guy up here in the major here to talk about this, but who would like to make a motion? Have a motion by Commissioner Nelson and support from Commissioner Joliet. Thank you.
Good morning.
Good.
I think it's still, yes. This is the third time we're coming to you to accept this funding, so it's a fairly new source of funding. It's $144,000 to pay for salaries and fringe benefits for recruits that are, while they're in the academy. So we get reimbursement of up to $24,000 for each one, so this covers 6 recruits.
Thank you. It's nice to hear that we're receiving money. Any comments or questions? Commissioner Cavell?
So how long, if it's how much money do the recruits get paid, like hourly or?
Their normal salary, while they're in the police academy. And so
What
this,
is that number?
Oh, well, I mean, we can, it's their standard salary, I don't know what the hourly is, I can send it to you.
Oh,
They're-
so
but
the
this is
total
just
cost would
for-
be,
yeah.
depending if you're D1 or D2 going to the police academy, it's roughly $32,000 for D1 and 40-some thousand for D2, and the state will pay $24,000.
got it, thank you. That's what I was looking for.
Anything else? All right, would you prompt the vote?
Oh, look at that, good looking.
Joliet.
Yes.
Luke,
Yes,
Good
you
looking
have
house.
7 days, 0 days.
motion carries. Thank you.
Thank you.
Our next item is from our Health and Human Services, and it's an application to the Michigan Department of Environment, Great Lakes and Energy for the 2024-25 Rapid Methods and Microbial Source Tracking for Beaches Program. I have a motion by Commissioner Nelson, support from Commissioner Gershenson. And, we have Leanne here to talk about this.
It is good morning still. So good morning, everyone. So this is a little bit of a continuation application that we're asking from Eagle. And so obviously as each season comes up, and I know this is a high priority for everyone, this allows us to do that extra testing on our beach samples to look at the source of the contamination. And so this is a grant that really helps pay for that extra testing through our lab. It also helps some of our mileage for our sanitarian technician students that go out and do the testing. So this kind of adds to that funding that we have to run that program in the summer. Again, a lot of it is focused around this part is focused around our lab. We're also required to attend a training and a conference, and this covers that as well.
Thank you. Commissioner Nelson?
Thank you, Madam Chair. Good morning, Leanne. Quick couple questions. How many beaches total do we sample presently?
Okay, I know I have to go back in. So I think total for the beaches, we do 150 each summer. So we have private and public beaches. So I have to go back and look at the proposal because I know we put some things together. So this grant specifically is 12 additional beaches that we add for the source tracking. I know that's specific. I think it's 150 total we do per summer. And I can verify that and bring that back to you. I know the last time we brought the beach grant, I have that in front of me, but I don't have the exact number, but I think it's 150.
Nope, that's okay, because then it would be great to have that information, and I also request, out of the 150, how many are public beaches, and then how many are the semi-public beaches? With the agenda item for today's purposes, you did clarify my last question on, this is just to include that additional 12. Do we know offhand out of the 12 for this item today, how many are public and how many are semi-public?
I do not, but I can definitely get that back to you pretty quickly. I don't have it in my notes here, but I can probably, as soon as I get off here, I can get that information back to you.
I appreciate
And
that.
we do have the breakdown in the public, in the semi-public, so I will make sure you all have access to that.
That would be great. Thank you so much.
Thank you.
Thank you,
Commissioner
Madam Chair.
Joliet?
Thank you. Good morning. Quick question, is there somewhere on the county's website or specifically in Health and Human Services that lists the beaches that are getting tested?
Yes, we do have a website that lists the summer beaches that will be tested. I'm not sure if it's updated yet, but it will be. So each summer we have our own website, and the state also shows all the state beaches. So I can, when I send this public and semi-public, I can give you that information. I'm pretty sure they have selected beaches for this summer, so I can get that back to you as well. I have to verify that, but I'm pretty sure those have already been selected as well.
Great, thank you.
Thank you. Anything else? All right, will you prompt the vote, please?
Taylor,
Yes.
Erickson Galt,
Yes.
Gershenson,
Yes.
Joliet.
Yes.
You have 7 yeas, 0 nays.
Motion carries. Thank you. Our last scheduled agenda item is a public service recommendation from the medical examiner. It's a motion to approve the organ and tissue procurement agreement between Gift of Life of Michigan, Eversight, and Oakland County. Who would like to make the motion? I have a motion by Commissioner Taylor and support from Commissioner Gershenson. And welcome.
Good morning, Kaz Majorca, Administrator with the Medical Examiner's Office. We've been working with Gift of Life and Eversight to come up with an agreement. It's mandated by Public Act 176 that we have an agreement if it's requested by them. We worked timelessly with them and trying to come up with an agreement that works for both the Medical Examiner's Office and their needs. Part of that agreement requires us to make timely reports of deaths to Gift of Life and Eversight for their purposes. And part of that, they've agreed that certain cases that would come to our office prior to them going to the body going to the Gift of Life. In addition, because of the additional workload, we negotiated with Gift of Life to have them upgrade our software so it will automatically start reporting cases to them. It'll take a few months to get that enhanced, but they've agreed to do that for us.
Thank you.
And I just want to add, Barb Hankey, I'm the Director of Public Services, and the ME's office falls under my purview. Thank you to all the commissioners. I know that this is an agreement that has been in the works for a long time. There was a lot of relationship building that we had to do. Gift of Life has been wonderful, and we really do think that this will help all the citizens of the county, so we appreciate your patience.
Thank you. Any Commissioner Gershenson?
Thank you.
All right, anything else?
I have a
Commissioner
question.
Taylor?
Yes, I see that it's for 2 years. Was there any thought for it to be a little bit longer since this is very important?
It will just be coming back before the board every couple of years and just have it renewed. So just in case things change, there could always be a change to the law or the legislation or.
That's true. Okay, no, I understand. Yep, that's true. We do change the laws. So they do.
Yes, thank you. Thank you. I know it's interesting because we all have, most of us have the donor card, but who thinks about the process? Okay, would you prompt the vote, please?
Luce,
Yes.
Erickson Galt.
Yes.
You have 7 yeas, 0 nays.
All right, motion carries. Thank you.
Thank you.
We've arrived at our last public comment for the day. Is there anyone from the public wishing to comment? Then you would come to the front and state your name and community. And you have 3 minutes.
You're not taking turns, it's me.
Yes, it's you.
My name is Mike Judnick. I'm a resident of White Lake Township, obviously in Oakland County. What brings me here today is last week I was in a meeting, presentation, and Sheriff Mike Bouchard was there. And he was talking in general about some of the upcoming expectations, I would say, with our illegals that are coming across the border and creating crime here in Oakland County. I don't know if you're aware of it, the last one was done. He now has 6 Chilean men, I guess, gangs, 2 gangs that they have busted and they're now in our jail. And I was wondering, is there any way that Oakland County is tracking them, knowing where they're living, the numbers that are here in Oakland County, and how that might affect our public safety? One of the things that I saw this commission do back in January was to approve funding to the Bureau of Justice to be able to track our criminals across our cities, our counties, and actually our nation. And so I asked Sheriff Bouchard, I said, how come we're not going to be using this software? And he says, we don't know their names. They have 4 or 5 different IDs. We don't know where they live. We don't know. So no, we're not using that. And that, to me, as a citizen, is a little concerning. I just sitting here today, I just can't believe all the stuff that goes into 911. And I use that all the time. And I just never think about that process. And all I know is that I anticipate it's gonna be happening more. And so I was wondering if where they are, where the illegals are, is that a part of this commission, this committee? And is it something that could be going forward that will be on the agenda to corral them?
I have no idea what Sheriff Bouchard said. We could probably get an explanation for him, but I won't have an answer for you during public comment.
Understood, but could it be on the agenda?
We don't respond to public comment.
I understand that, Commissioner Cavell. Thank you. So yes, it's something we can discuss and explore.
Thank you for your time.
Thank you. Anyone else for public comment? All right, public comment is closed. There is no other business to come before this committee, and it is adjourned at 11:42. Thank you, everybody.